May I ask our final panelists to come up for the end of the program? What we are, Linda, Shannon, who's going first? You're going first, okay. So what we wanted to do in this part is to focus on the last area, which is chronic disease prevention and what we can do to avoid that. And so what we have here is we're having, again, two discussions here. One is regarding an overall diabetes prevention program, and then drilling down to an individual employer and how they're handling it. Starting out will be Shannon Hafferty, Director of Value-Based Benefit and Reimbursement for the American Medical Association. In this role, Shannon develops and implements strategies to engage health industry stakeholders to pilot and adopt innovative value-based benefit and reimbursement models supporting and improving the health outcomes of Americans. And then immediately following her, Lynn Hipp, a manager of Eastman Chemicals Global Integrated Health and Wellness in East Kingsport, Tennessee. She's spent her Eastman career working in HR, including both people and project management globally and domestically. She's responsible for enabling and inspiring the Eastman population in the achievement of the vision of a global culture of wellness and team members and family feeling better, longer, and influencing the communities they live. So please welcome Shannon and Linda.
Okay, end of the day. I'm Shannon Haffey. I'm at the American Medical Association, and I sort of have an interesting job in that I actually don't work with physicians. I'm one of the only ones in the House that does not work with physicians. I am trying to work with employers and insurers to better align programs that we're encouraging physicians to refer their patients to that align to the benefit design and the programs that employers and insurers offer. So we'll go through that, and then I'll share with Lynn. So today I just want to share a little bit about our strategy, why we're here, talking to those of you who have on-site clinics in your workplace. I wanted to share a very specific program that we're champions of along with the Centers for Disease Control and Prevention in Atlanta, and then talk about actions that employers can take in their on-site clinics and illustrate with Lynn here from Eastman Chemical how you can implement those programs. So the AMA is the largest body that looks after physicians' needs and interests, and we advocate on behalf of physicians. And in that realm, we actually have 3 strategic focus areas. The one that I come from is actually how do we improve the health outcomes of this nation. And in doing that, we've selected our focus to be on prevention of chronic disease. And we're first looking at prevention of stroke, cardiovascular disease, and type 2 diabetes, since those tend to be, per probably all of your claims, some of your highest cost culprits and health culprits. So that is where we're focusing our time. And if you think about your population, the statistics show that approximately 35 to 40% of your employees are at risk for one of these chronic conditions. And in some employers that I've talked to, it's even higher. For example, Lynn will be able to share some of her statistics. So we want to develop programs that, and support programs that physicians can refer their patients to that are more intensive than the usual source of care, which is 5 to 7 minutes a couple of times a year to talk about diet and exercise, which, as we know, since the trends are going up, is insufficient. Part of the framework we've put together with our physicians and the clinical practices we work with is addressing several other things that are outside of a care team or clinical practice. The first is looking at these chronic conditions and how do we raise awareness. So how do we raise awareness of risk factors for all of the patients and all of your employees and members of health plans? How do we raise awareness with physicians that there are risk factors that can be prevented and lead to chronic conditions but can be addressed if you catch them early enough? We want to work on financial coverage. So physicians would feel better about referring their patients to programs for which there isn't an exorbitant out-of-pocket cost. We're looking at availability of programs. So how do you get people into programs at the right time, close to them, delivered by the right type of intervention or individual? So it doesn't always have to be a physician. which might sound a little weird coming from the AMA. And then we want to look at how do we enroll people, how can we engage them. So one of the things that I hear the most when I talk about to employers is how do we keep our individuals who enroll in programs until they get healthier or show outcomes. And there are a couple of programs that are out there that target that. So specifically, I want to share a program called the Diabetes Prevention Program that is backed by the Centers of Disease Control and that we are a partner with, and I'll talk a little bit more about this work. But the focus is on identifying individuals with prediabetes, which is a reversible condition. It's indicated by a blood glucose level that's elevated, but not yet at the level to be diagnosed as diabetes. And you can change it, and you can bring it back down. And again, 1/3 of the population is at risk for this. And in fact, I think 2 months ago in the journal of our JAMA, our monthly magazine, there was an article about 50% of this country either has diabetes or is now at risk of developing diabetes with prediabetes, and it's only increasing. So the National Diabetes Prevention Program is a year-long program delivered by lay coaches. It targets moderate weight loss through education of physical activity, nutrition in a group setting. There is social accountability of being part of the group. Importantly, it's delivered by a lay coach, so it's a lower cost to serve. There's about 15 years of evidence for this program that it has better outcomes than prescription drugs, so standard prescription is metformin. It has better outcomes than metformin, and it has better outcomes than seeing a physician just for guidance on nutrition and exercise. So those that go through the program have and complete and achieve outcomes have a 58% reduction of developing diabetes. And importantly, there are costs and other outcomes that are listed up here as associated with the achievement of this improved health, which are things like improved control of hypertension, coming off medication, reduced medical spend from downstream more severe chronic disease development and the treatments and intervention for those. So we fully support these. What we are trying to do with the CDC and with one of our other partners, the YUSA, is get physicians to screen and test their patients and then refer eligible patients to a local diabetes prevention program. There's actually 2 modes of this program. There's an in-person program, and then there is a virtual program. So when we talk about telemedicine and telehealth, there are virtual diabetes prevention programs delivered by lay coaches that meet telemedicine and telehealth state guidelines that can be delivered to your population. And then for an in-person option, there's plenty of options. So we'll talk a little bit about the WISE program with what Lynn has experienced. And there's also opportunities to get, if you have your on-site on-site health coaches that can be trained to deliver the curriculum. There's also the opportunity that the Y would, for example, come to your workplace and train the curriculum at your workplace. So there's a lot of options to offer this to your employees as convenient for you. This is an example of what we have been doing to work with clinical practices. We started about 2 years ago with the YUSA, and we developed tools and materials to help physicians and clinical practices understand who in their patient panel had prediabetes and would be eligible for these populations. And we now want to work with organizations like yours and understand how can we capture those that are at risk in your population and hold to that the physician-patient relationship, but get these patients into this program. So we believe, and some early evidence suggests, that if an individual's physician encourages them to enroll and encourages them to stay in the program throughout the year, the outcomes are significantly better. In fact, the average is about 10 to 30% of those that enroll in the program achieve health outcomes and complete the program. If their primary care physician is engaged in a conversation with them throughout the year, the outcomes are showing higher than 50% right now. So we believe that physicians have a role to play to encourage individuals to enter these programs. The other thing that we embarked on is in March of this year, we developed an awareness campaign with the CDC, and it's right now targeted at the public and physician and care teams, and there's tools that can be downloaded to engage physicians. And then the other thing that we're working on are tools for employers. So right now we are developing tools that help develop the business case and estimate the cost savings that you might experience if you offered this program to your population. And, for example, brought it into your clinics. And that will be available in the middle of November. So we're hoping to get some traction from that. We're working with several employers to model what their data and statistics look like and what their claims would look like. And so given that, I want to turn this over to Lynn so she can share the implementation of this program and how it worked for her employees.
Okay, unlike how we started the morning with the individual saying that he didn't have slides, and so he might ramble, I have slides, and I have pages with tons of notes on them. I have to look at those, otherwise we'll be here in the morning, because I could talk about this forever. First of all, before I get started, I want to point out Christine Harding from the YUSA is here. She's in the back of the room. And so, Christine, wave your arm because y'all are all going to want to talk to her by the time I get finished. And I also have to welcome my husband, who doesn't normally get to see me do these things, but he was with me today, and I asked him to come see what I do. So he is the wind beneath my wings, so I appreciate that. This really is. Can you go back just one? This is how we started our year with our wellness brochure. This is your year, to try to get people engaged, take ownership, all the things y'all talked about all day long, all the things we struggle with. You'll see the banner across the top is what we have branded all of our benefits and wellness things with starting last year, and that is wellness plus prevention plus consumerism equals a healthier Eastman. So it isn't just about me as an employee being healthier and contributing to the bottom line. It's about if all of us come together, it's better for everybody, which is something we talk about a lot these days because the quote-unquote healthy employees are always mad now because we focus on outcomes-based, and so what's in it for me? Well, you know, what we tell people is just because you're healthy this minute doesn't mean you're healthy the next minute, and are you really healthy? So we're constantly fighting that battle. So we were hoping that this could bring the entire domestic population. Let me back up. This is domestic only. So Eastman is a global manufacturer of advanced materials and chemicals. We are very much global. We're starting to have even a bigger footprint outside the U.S. than we do. But still, our biggest cost from a medical standpoint, and probably always will be in the U.S. This is where the majority of our employees are. And in fact, half of the 14,000 employees we have to date are sitting in Kingsport, Tennessee. We have rolling shift that's 24/7, and which contributes to your metabolism never being able to figure itself out, and so it's constantly causing health problems. But we've got about 4,000 people on site at any given moment of any given day, 24/7. Before I go to the next slide and show you what our risk factors look like, the brochure of NAWHC that you've got in your packet, if you just pull it out, I want to just point out one thing. On the brochure, if you flip to the benefits and activities section, to me this is a great, I've sat here all day and listened to everybody, and what struck me is we as Eastman Chemical Company have been doing all of these things and more for over 20 years. To manage employee health, we've got occupational health. We have a staff of work re-entry nurses. If somebody's been off sick, they come back through to try to help. We have on-site EAP services. We have 4 full-size fitness centers on the Kingsport site, as well as some satellite fitness centers on the site. We have great fitness rooms all over the site. We have wellness programs. We partner with Cigna as our health provider to also offer our wellness programs. We also have cafeteria services 24/7 because we've got employees working 24/7. We have just launched into a new contract with Sodexo, and we're so excited about this. for the first time ever in our history, we'll have one provider that offers all the food offerings. And they have such a great marketing presence that will save our staff of two from having to market how food fits with being well and how it helps improve your health. So again, it's just one other spoke in the wheel. We have MD Live this year for the first time ever. We've got industrial hygiene and ergonomics. We have on-site health coaching. We tried on-site pharmacy for about 5 years, and the sheer magnitude of the complaints and dealing with them just didn't offset any cost savings, and so we said, okay, let's move on. This obviously didn't work like we hoped it would. We now partner with CVS, great relationship that we just started this year. So we've got local pharmacies that we focus on. But just wanted to say, we've done almost everything I've talked about in some shape, form, or fashion for years and years. However, this is what our risk factors look like today. Yes, they're not any better than anybody else's, and one of the things I would point out is that if you look at overweight, which is BMI of 25 to 29.9, yes, that's 40%, and yes, if you add obesity, so BMI greater than or equal to 30 to 34.9, if you add those together, it's 79% of our population. Now, this is domestically, but none of our sites look much different than this right here. We don't have any sites that we figured it out, and they look much better. Now, we sit in the South. I would venture to argue that the South is more unhealthy than the Midwest, but I'm glad somebody else is saying they're the most unhealthy, which makes me feel a little bit better. But we've done all these things, and yet we were not getting to the root of the problem. You can see that diabetes says it's just a fraction, but prediabetes is near 30%. Yes, we've made improvement in all of these areas, and we're thankful that we have. And people tell us if you could just hang on to what you've got, you're better off than most companies these days. But we're just not willing to do that. So we're doing many, many things, but what I'm going to talk about today, if ever there was a silver bullet to impact weight and physical activity, we believe that the Y Diabetes Prevention Program that is the CDC's program is it. Because of those populations in America that have prediabetes, 1 in 3 people have no idea they do. And that's evident when we do screenings. So 5 years ago, well, in 2011, our board of directors said, okay, the health of the population is so bad, we want you to make sure you're tracking it, so these metrics were put in place. And our board of directors actually takes a look at these at least once a year, usually more because some CEO's on a plane with some other CEO, and they talk about some magic wand they found, and so then we get the call, and some of y'all are laughing, you get the call, you got to do this right this minute to fix this problem, and we kind of shake our heads, go, okay, and then hope they forgot about that for a minute. So we are looking at these, and you can see when I look at decreased obesity to 30%, it just makes me sad. But at the same time, that would be a 10% improvement from where we are. That's huge. No pun intended. Decrease prediabetes to just 22%. That would be huge because the programs we're talking about deal directly in weight and activity, nutrition, and it's not rocket science. As we hear people say all the time, it's not rocket science, but somehow this program has been put together, and there's a social network to it because you're doing this in a group that causes people to be able to, the light bulb to go off and make a difference, even though they've heard these same things their whole lives. So just a little bit about where our outcomes are so far with just this year. and I'll say that we also work with Veridian Health Management Company to provide this same program, because it is the CDC's program, at one of our sites, because there's not a wide close that we figured out that can deliver it, and we get the same results. So just this year, we have 246 total participants enrolled, and this was as of 2 weeks ago. It goes up every day. The snowball is growing very rapidly. Those participants have lost 1,816.6 total pounds lost. That's just this year. If we look at the total of 500 participants, they've lost in excess of 7,200 pounds. Now, that means we had a lot of pounds to lose, but that's a lot of pounds. That's an average of about 14 pounds per person. And when you think about that, that's a lot for a person. Now, we've got individuals who have lost 40, 50, 60 pounds. And you can see them disappearing. And we talk about that. And I'll talk more about that just in a few minutes. But we also are having better than your average results through this program. And we think that that is because, if you'll go ahead and go to the next slide, a couple of reasons why we're successful in that. And some of this is blurred out for a reason, so you really can't see it till you download it yourself. But the first circle on diabetes prevention program, we had two focuses from the wellness organization for this year. We are doing all these great things, fitness centers, all these great things. But what we found was we have got to focus. We have got to focus. So I came across this. My boss, she is an amazing woman, and she's constantly giving us things to inspire us in our lives as well as our work lives. And so there's a calendar. It's called Seize the Day. I thought it was very appropriate that the one for today said, and this applies to all of us as we try to lead organizations or be part of organizations. It says, what makes a river so restful to people is that it doesn't have any doubt. It is sure to get where it's going, and it doesn't want to go anywhere else. This is a quote from Hal Boyle, who was a Pulitzer Prize winner back in 1945. And what that says to me is each of us have got to figure out what the course is and then take our people with us on that course and still have all these things, but we've got to help them focus. So what we decided that this year and next, one of two focuses for benefits and wellness was going to be this diabetes prevention program because we're seeing such fantastic results. The second of this, and many of you have mentioned it today, is leadership. Without leadership, and it's not even support, it's buy-in and driving it, then you won't be near as successful as what we have been. And we have said, okay, leaders, you want us to help you get the population healthier because you've got employees who can't even do their jobs because they are so overweight they can't climb the ladders they need to climb. And so their group figures out who's going to do which job to compensate for everybody else. And so we're trying to help you, but that means you've got to help us. So we're offering this program now on company time. It's an hour a week, and there is a brochure, and I don't want you looking at it right this minute, but there is a brochure on the table. Take more than one, please. We've got some more. Spread them around your world about the details of the program, as Shannon has already mentioned. But it is an hour a week off the job, and we don't have resources to backfill for these people anymore. So it means somebody else has got to help with that. So it's a big deal for a leadership group to let folks on an operating floor that work 24/7, 365 off for an hour a week and make that commitment and stand by that commitment even when something happens in the middle of the year and things get tough. So they have absolutely partnered with us and are champions of this. The other thing is that the cost is less than $500 per participant for the year-long program. Now, that's one of the least expensive things we have ever done, and technically the cost is $429. So it is less, very much less than $500 per participant. But it amazes me that we've tried all these other things, especially for weight, and spent a lot of money per participant doing that. And yet we found something that is low cost in the world of wellness and benefits and has such great, dramatic results. The other thing is this social networking piece. We all talk about social networking. But what we hear folks that are in these programs say, and let me say, our average age is 54. We are predominantly male population. We are mechanics, chemical operators, chemists, engineers, process-oriented type people. These are not typically men who ask for help or even take it if you give it to them. And yet, they have realized that it can make a difference in their lives. We also offer the program to spouses. We have sessions that are delivered right in the work areas and off-site through the Y. And the Y delivers everything. They came to us. We contracted with them. And we pay once the first session has ended. They bill us. We pay it. And then they're responsible for the rest of it. So it's less work on us than a lot of things that we do, but yet we're probably more engaged in it right now. In fact, the person that works for me, her full-time job has become managing the diabetes prevention program because it is snowballing on us. It is just wonderful. Okay. Now, I will say that one of the things that helps people want to be in the program is that we do have an incentive strategy. Oh, dear, 5 minutes. Oh, no. We do have an incentive strategy, and I'll leave it to you to read that. Let me just say, we've had an incentive strategy besides do the health assessment to get premium reduction for next year. We've had incentives, $300 a year for participating. Last year we said, forget that, we're not getting to the right population. We're going with outcome-based only, with the exception of doing some apps and activities on Cigna, and next year completed biometric screening will also be worth $100. But we're focusing on weight, LDL, and glucose, and that's it. And yes, we have people holler that my BMI is not greater than 30 and I can't participate. Well, you should thank your lucky stars and keep it that way instead of griping about the fact that you can't do what these folks do. So it does help. Now, this program, the Y program, is just one way, and what we tell people, it's just one way to help you reach your goals. We do not have the incentive associated directly with the program. So what I want to do is just real quick, three instances. This is Mike. You could see that when Mike was 21% heavier than what he is, he was still running. He was still doing things, trying to figure it out. It just wasn't working for him. And what he tells us is it didn't come together until he got in that group setting. We also, so this is the company helping somebody live a healthier life. We've also got changing the culture within. So we had one participant male, who about halfway through the program, she'll hit it once, about halfway through the program, which drove to the grocery store with his wife and kids after work one day, and he had a shopping cart, she had a shopping cart. He was putting his stuff in it because he knew what he should be eating. She was putting all the other stuff in it for the rest of the family. And he said, wait a minute, and stopped everybody in the middle of the grocery store aisle and said, we should not have two shopping carts. If I shouldn't be eating it, you shouldn't be eating it, and our kids surely shouldn't be eating it. This has got to stop. So they put back the stuff in the family grocery cart. They got his. They went through the store, and what he said is it was a monumental moment in their family because they started eating together at the table, talking about nutrition. He said, but we started playing together. He didn't say exercising together. He said we've started playing together as a family, and this program has changed not just my life, but the life of my family. So, again, it's changing the culture. We had one participant, go ahead and, one more, keep going. One participant who said, just do them all. One participant who said that because of the goals he met with the weight loss, that he was able to save $500 on his prescription drug, and he didn't even see that one coming. So, yeah, it is all about cha-ching. okay, and not just for the company, but for individuals as well. Okay, the last one I want to talk about is really impacting the community, because we're very big on impacting the community. And this is an individual who we have a community huge festival in the summer that's called Fun Fest. And as part of that, we as a company participated in a walk that was done as part of what's called now Healthy Kingsport. And so they were asking us to help fund some things to get people there, and we said, okay, fine. I said, okay, what I'm going to do is I'll pay for 4 residents to go through the Kingsport Y Diabetes Prevention Program. Y'all figure out if they're qualified and all that. So the Y did all the work, and this woman won one of those. And the Y gets emails from her all the time. And she basically says, have I told you that diabetes prevention classes changed my life? And she actually works for Eastman Credit Union, no affiliation anymore. But because of her and the success she's had, the Y is now going to be delivering these diabetes prevention programs on site at that company as well. So think about how you can impact the community through a raffle or a giveaway to get other people in besides your employees and their spouses. Use it as a bigger platform. So I talked about how we are losing people. This slide represents 36 people that we've disappeared because of how much weight we've lost. And it's a great way, it's a great visual way to show what's happening, because we literally have groups who say, we can all get in the elevator together now. We couldn't do that before. You know, we all do the same work because we can all do the same physical work now. We don't have to trade off who does what because somebody's too heavy to do what they're supposed to be able to do. So we have seen huge impacts with this. Now, and we have it at more than our Kingsport campus. We started at 2 campuses. We've now added 2 more. We've got 2 more in the works for January. So we continue to expand, and YUSA has just been incredible to help us be able to do that. Next steps for us is to impact the local physician community, so that a physician says, instead of saying during an annual physical, you know, let's watch your blood sugar. It's getting a little high. Let's watch it. And I leave the office, and I don't know how to watch it. He said he's going to watch it, so I assume, okay, next year we get there, it's a little higher. We need to watch that. And then one day he goes, oh, my word, you have diabetes. What we want is that physician to say, you know what, we have in this community a program so that you can keep from getting diabetes, and I want you in it. By the way, if you work for Eastman, they pay for it. We're hoping that Cigna, our health plan, helps us get some kind of code to where it actually can go through health plans. Some health plans have already done this so that it actually can be paid through the health plans. We hope that happens with all carriers, because that would just be huge and really help the population. Just like if you don't know a whole lot about the Y, one thing to keep in mind is the Ys, most all Ys have scholarships for folks that can't afford to join the Y but need to join the Y. And it's based on their income, and it's pretty much self-reported. This program may be one of those as well, and every local Y is different. But that's another option, because we need folks who are in low incomes to be able to take advantage of these programs. I appreciate so much the opportunity from everybody today to let us come and talk. I would say let this be your year too. Take this brochure, and yes, you can call Kingsport if you want to, because that's the number on the back, but I would encourage you to call your local Y and get in touch with somebody there to say, do you offer this program? And if not, let's start talking to YUSA about how you can get ready to offer the program for your Y, so that you can help be that leader and them being able to deliver the program. Thank y'all so much.
Well, that's been very inspiring for the end of this session. Questions from the audience? Mindy, in the back, the first one. Have a seat, lady.
Nice presentation. Couple questions. One, is there a rolling admission into the program or membership? You said it keeps snowballing. Is it like a 6-week program, 8?
It is a 16-week, once-a-week program, and then the remainder of 12 months, you go once a month.
So what if I show up at week 9?
I'm sorry?
What if I show up at week 9 and want to get in? Is it
No,
for a new program?
no. This is very, very structured so that whatever group you start with, you start week 1. If you miss more than 2 sessions and don't make them up, then you're pulled out of the program. It's very structured. It's a huge commitment on the employee's part.
There are rolling classes, so, everyone starts with week 1, if you will, but there could be a week 1 that starts the first week of October and a week 1 that starts the third week of October, and whoever's your provider, like the Y, would work with you and your population so that it would be optimal.
Got it. Thanks. Okay. And then the other one is, you mentioned about a $500, I think you said $429. Is that an all-in cost, or does that include the paid time off? I think you said incentives were separate.
That is just the cost to the Y. That does not include the off-work cost or the incentive cost. Those are totally separate. And let me say, yes, we have many, many classes going on at the same time. One day last week we had 5 classes that started on one day. So it's not like you have to wait 16 weeks to get in the next one.
Michael, you have a question?
Yes. How are participants determined or selected for the program?
Great question, and one of the things that's in the brochure on the table is a questionnaire, and if you score 9 or higher, then you are in the program. It's about family history, and then also your A1C level determines if you can get in. So part of CDC is at least 50% of the participants have to have an A1C level in the range. The other 50% can be by family history only.
Are you identifying them and inviting them?
We have information sessions that the Y conducts for us that talks about the program, and then they do A1C screening right then and there. So somebody could have answered the questions or done the A1C. But anybody can come and hear about it. We have a lot of people who come and hear, and then we've got one leader who paid for his mom to come because it's part of a community thing. So
I would just add, for example, we've seen employers tie it to their biometric screens that they do as part of your on-site clinic. So one of the things that we're trying to do at the AMA is most biometric screens offered by third parties identify if you do not have diabetes or if you do have diabetes. And so one of the things we're trying to do at the AMA is define that middle band of pre-diabetes so that when you are doing your biometric screenings on site, that risk is identified, and then there's a so what. So go to your physician, talk about this program, or if you are an employer sponsoring this program, go into this program.
Great. Other questions? Let me ask, we talked earlier today about the concern about fragmentation of programs. Is this program linked, does the information go back to the patient's doctor, or how does that, can doctors recommend them? Does Eastman communicate with the local medical docs, or how do you work that?
Eastman does not communicate because we don't have that information
right.
As an employer, but the Y talks to the individual, and they will send the information back to their doctor if they choose to do that. They have to sign a form to say, I want this connected with my physician. But that's another reason why we want the physician community in where we live to be part of this so that they can be a true part of it and it be part of medical records and that kind of thing.
Sure, and also most health plans offer some disease management. They generally don't offer, I think, a pre-diabetic management program, right. But do you somehow give information or does Y give information to their plan if they wanted to?
We don't today. We hope that's part of that next step, working directly with Cigna so that those things happen. I know there are some health plans in the states that do have a direct connection.
Great. Also, for anyone who knows, the YMCA of USA is actually just a block or two away. They're in Chicago here, and we can have some discussion. Other questions? If not, let's thank Lynn and Shannon for the great stuff. Okay, I want to, first of all, ask you again, please complete the evaluation form and submit them as you leave. I want to announce the 3 winners of the door prize in order of price. Number one for $50, the first winner is Latasha Kimmons. Latasha, come on down. Our second winner is Brad Leonard. Brad, are you here? And the number one winner is David Hines. Hey, come on down. Welcome, welcome. Here you go. Congratulations. Sure. I want to thank our sponsors for the day, the American Medical Association, the Foundation for Chiropractic Progress, NCQA, Marathon Health, and Premise Health. I want to thank all of you for hanging in there, and I want to thank all the speakers. Please consider joining MBGH and NAWHC. We hope to see you at future programs. Thank you all very much. Have a safe and enjoyable weekend.